Currently, I have a fungal infection in my brain, and it's been a very long process trying to get medical care for this. Let me take you back to the beginning. I got sick about 3.5 months ago. I started getting these headaches. I was very tired, and I just didn't feel well. I had muscle aches and muscle weakness. Now, my doctors just thought, well, you have mitochondrial disease. Maybe it's a flare up of your mitochondrial disease. When I continued to worsen, I was told, well, maybe you have a virus. Viruses, they do go around. Maybe you're having a virus. I continued to get pushed off more and more. And it wasn't until I finally developed sepsis. I went to the emergency department. They did blood cultures and they found out I had a fungal infection called candida parasilosis. Now you might think, well, they should have just done those blood cultures months and months ago, then they would have found out you had a fungal infection. No, not so fast. So let me walk you through why it is so difficult to get medical care for a fungal infection. First of all, the fungal infection I'm going to primarily talk about is candida. Candida can be introduced into your body for a number of different reasons. Primarily, the number one, number two, number three reasons are indwelling catheter devices. You have a urinary catheter, you have perhaps a PICC line or a portacath or a Hickman. You have something that's going into your body. There's been a breach in your skin. And because of that, now this fungus has access to your bloodstream. Now, another thing you need to have some sort of contamination from the fungus. On our skin, we do have candida, either candida parasilosis, candida albicans. There's a couple different candida species, and they can be on your hands and they can enter your bloodstream. This can be due to not washing your hands, or perhaps something got contaminated. Once this infection has entered your bloodstream, it can do one of two things. First, it can actually make you very, very sick, and it can cause sepsis, and you become very sick, and they're going to do blood cultures, and hopefully they will find the candida on blood cultures. I will tell you though, blood cultures are not very effective for candida. Depending where you are and depending the culture media they are using for the blood cultures, the blood culture can be effective as much as 22% up to 78%. With that said, even if it's effective at 78%, that means 22% of the time, the blood cultures do not show a candida infection. That is pretty scary. If you have 100 patients come in that all have candida, only 78 will show that they actually have candida in their bloodstream. The other 22, it will say, no candida in their bloodstream. They are normal. So that's the first scary little tidbit. But the second one is candida that enters your body does not always cause a bloodstream infection. It can affect an organ. Perhaps if you have a urinary catheter, it can go up, it can affect your bladder, maybe it'll travel up to your kidneys. It can affect other body parts, and it can just slowly start making you sick. Candida, unlike bacteria, unlike some viruses that once you get them, bam, you are sick and you're so sick. Candida will just be a slow infection. It starts off very small and it just very slowly starts growing. And because of this, you do not launch a full-fledged immune response to this. Your immune system says, oh, we don't like that, but they don't launch out an all-out attack. For this reason, your white blood cell counts usually do not elevate. So you go to the doctor. Oh, doctor, I'm not feeling very well. Oh, and the doctor asks, well, what are your symptoms? And you tell them the general symptoms you're having: fatigue, muscle aches, headache. Maybe you're just even having a little bit of weakness. You're just not feeling yourself. So the doctor says, let's order some blood work. The blood work is resulted, and most of the time, your total white blood cell count is normal. That's right. You do not have an elevated total white blood cell count. Why is this? Because your body is not launching a full-out attack against this fungus that's in your body. It's just slowly growing, and your body's thinking, it's not really a big deal. We're not too concerned about it. Now, you might have some other factors that may be slightly altered. For example, the type of white blood cell that you have might be abnormal. For example, your neutrophils might elevate, your lymphocytes might go low. Perhaps, maybe, but not always. You could totally have completely fine blood work. With that said, you're never going to be diagnosed with this fungal infection, and you're going to continue to get sicker and sicker and sicker. Why is this very dangerous? Because here you have this infection and it's just brewing and getting stronger and bigger and more powerful. And your body is not fighting it very well. They're just a little bit here and there. So you're not overly dramatically sick. Perhaps you might run a fever, maybe a low-grade fever here or there, or perhaps you have absolutely no fever. But in general, an infection is not suspected. That is until this slow infection that grows and grows and grows, perhaps takes months. It sometimes can even take years for it to grow to such a manifestation that it will leach into the blood. Once it goes into the blood, it causes a bloodstream infection. Now, this is where you say, blood cultures. Remember, blood cultures are not that effective at diagnosing candida. So the doctor sees that you're sick and he thinks, oh no, they're sick with sepsis. What do I do? They immediately think to give you antibiotics. That's wonderful. That's a good course of treatment, but not for you because you have a fungal infection. You need antifungals. Unfortunately, antibiotics are going to do nothing for your fungal infection. You're going to keep getting sicker and sicker and sicker until they figure out it's a fungal infection. Now, hopefully, if you're getting sicker and sicker and sicker, they will use wisdom and logic and think, maybe it's a fungal infection. This hopefully will occur to them if you have some sort of indwelling device, if you have a urinary catheter, a tracheostomy tube, some sort of central venous line, or perhaps you're immunocompromised with perhaps AIDS, HIV, or some other disease that causes your body to be immunocompromised. If they do not start you on antifungals, this infection is just going to bloom, and boom, you are going to pass away, unfortunately. Fungal infections are very, very deadly. And once you have them, you really need treatment. They do not go away on their own. But let's just say you had blood cultures and they revealed you had a candida infection. All right, now we are going to try antifungals. And you think, oh, wonderful. Which ones are we going to try? Technically, there are only 4 classes of medicine that can treat candida infections. Those are the pollines, antimetabolite 5-fluorocytosine, the azos, and the echinocandins. Really, there are only 2 choices because the first 2 that I mentioned are not very well tolerated. The azos and the echinocandins are better tolerated, and really this comes down to usually using one of 2 drugs, either fluconazole or micafungin. Those are the 2 general drugs that are often used for candida. So you really only have 2 drugs to choose from. And I'm going to tell you some really bad news because there are so few drugs to choose from. A lot of candida infections are growing resistant to these drugs. What happens once you become resistant to these drugs? Pretty much that is it. You just have to hope and pray that the drugs work. And if they don't, we don't have any other treatment options. But let's just say, hey, you have a diagnosis, you have candida. And we have a drug that treats you, we're going to say it's micafungin. Great. But if this bloodstream infection has affected another part of your body, let's say it affected maybe your brain or your kidneys or your lungs or your heart, you're going to need a long course of medicine. With that being said, usually when you're in the hospital, they will set you up with a short course, maybe a week, maybe 2 weeks, and they say, go find an infectious disease doctor. Maybe the infectious disease doctor at your hospital will see you, but maybe not. Because we are talking about fungal infections are a very specific type of infection. Infectious disease, the specialty is very broad and it covers a number of different things. Let me just list to you some of the things that infectious disease doctors treat. They treat bone infections, joint infections, central nervous system infectious disorders, chronic fever, diseases acquired in foreign countries. This include tropical diseases, endocarditis, fungal infections, HIV, AIDS, influenza, osteomyelitis, post-transplant infection, sepsis, tuberculosis, and the list can go on and on. As you can see, the field for infectious disease is very wide and very broad. Although an infectious disease doctor should know about how to treat a fungal infection, unfortunately, a lot do not. That means you need to find somebody that specializes in treating fungal infections. You think, How hard can that be? Let me give you an example. I tried to go to a major medical center. They had 24 infectious disease doctors. Out of the 24 infectious disease doctors, only one specialized in treating fungal infections. And you think, great, let me get in to see that doctor. Not so fast. Unfortunately, because there's only one doctor that treats fungal infections, there's no guarantee you're going to be able to get in to see that doctor. That happened to me. The doctor was booked for 2 months. Unfortunately, you probably do not have that much medicine to last you 2 months. In the meantime, if you go off the medicine, your fungal infection could become resistant to the medicine. Oh boy, this can just be a total catastrophe. Finding follow-up care can be a big stumbling block. Although you might find an infectious disease doctor, he doesn't necessarily specialize in fungal infections, and it is really essential that the doctor knows about fungal infections. Why? Because fungal infections, like I said, a lot of times do not elevate your white blood cell count. If they're only seeing your white blood cell count and they're saying, oh, your white blood cell count is now normal, no more treatment for you, that is wrong, because that's not how you treat fungal infections. You treat fungal infections until the symptoms are gone. It does not matter about your white blood cell count. It does not matter if you're having a fever or not. You keep treating. Hopefully, your white blood cell count will be normal and you'll have no fevers and your symptoms will completely resolve. When that happens, you continue treating for another 2 weeks after that. So even when you're like, I feel great, not so fast. You are not done with treatment. You need 2 more weeks of treatment. Even after you get the 2 more weeks of treatment, you need continued monitoring. If your symptoms come back, you need to restart the medicine. If you have any sort of flare-up, you need to get treatment and intervention to find out if perhaps your fungal infection has returned, because fungal infections are very sneaky. They like to sneak up and come back and reoccur. They go into deep recesses. They get tucked into nooks and crannies, and they can hide and hide and hide. And it's possible that even your infection after 1 year of being infection-free can come back and cause havoc on your body. So you need to keep all these things in mind. And this is why it is so difficult to get medical care for a fungal infection. You just don't treat the infection and say, it's gone, white blood cell count is normal. No, you need to constantly be proactive, continually looking for this infection, and anytime symptoms reappear, you need to actively go back, treat the infection, and continue medical treatment and medical care for the infection. So thank you so much for joining me. Please remember to like and subscribe down below. Please also remember to comment and share. It really helps my YouTube channel. I hope you have a great day and a wonderful week. Bye-bye.